So what we are doing here at this Chennai Chest Pain Initiative is we have ambulances which has a separate number, this Chennai Chest Pain number. So wherein you call this number, it is being answered by a paramedic immediately, and the location gets it by the paramedic, and this is all transmitted to the ambulance mobile. And we have a new initiative at the ambulance. What it is a 5G ambulance, where once the link is shared, the ambulance can take a Google map with that, and it can reach the patient, and even the patient who has activated the ambulance will also have a link so that he can track that this ambulance is on the way. Once the ambulance arrives at the scene, once the paramedic reaches the scene, the vitals what he is capturing will be transmitted to our control center, that is in the emergency department, where 24/7 emergency doctors and 24/7 cardiologists, as senior cardiologists, will be available to evaluate this chest pain, and we ask them to do an ECG. Once the ECG is done, that ECG image can also come to our control center. We see that if it is identified as a myocardial infarction, the treatment starts there. It is with a cardiologist and an emergency doctor at the control center take over the patient on this network till the patient reaches the emergency department. Once the patient comes to the emergency department, we know that this patient has this myocardial infarction. We do a quick echo screening and some blood samples, and we'll push him immediately to the cath lab so that his life is saved, that too in a very short duration. By the time we know that this patient needs an PTCA or angio, we prepare the lab and we keep it ready, and we know we are going to do it in a very short period.